right, welcome everyone to today's UMTRC webinar series. We like to do these a couple times a month. I'm Becky Sanders, the Program Director for the Upper Midwest Telehealth Resource Center. And just a couple housekeeping items before we get started. If you are an attendee today, you are in listen-only mode. You can use the Q&A button at the bottom of your Zoom screen for asking questions, and we encourage you to do that just in case there are questions we cannot answer today. That way we have them and we can get answers to those and get those back out to you. As you noticed when you signed in, we are recording today's session. This session will be archived on our YouTube page, and the slides will also be with the recording on our archived webinar page. We will be taking questions at the end of today's presentation. If there's something in particular that needs to be answered right away that was incorrect on a slide, or you really just didn't understand, go ahead and use that Q&A during the webinar to ask those questions. We ask that you refrain from using the chat feature unless you are having technical difficulties. And in that instance, Carolyn Miller will assist you with those. So I want to take the time before we get started to say thank you so much again, Sandi. This is not the first time she's delivering this presentation for us. We had a window in June and July where we were able to hold large gatherings in person, and we actually had Sandi give this presentation at our annual conference, our third annual conference in South Bend, Indiana in July. We had a great conference, and so many people came up to us and said, you know, the quality and topics in the breakout sessions were so good, I couldn't see everything that I wanted to see. So we've brought back some of the presentations from our conference, and Sandi is going to be doing this presentation for us again today. So Sandi, at this point, I'm going to hand things over to you.
Thank you. I appreciate that. We'll start out just a little bit with welcoming everybody, and I thank you for taking the time to listen to my presentation. Little background on me. Been a nurse for more than 20 years. Most of my nursing career has been in the emergency room, and then moved on to some leadership and management positions from there. And currently, I'm the Director of Telemedicine for the Lutheran Health Network. And enjoying that very much. As you can tell from my voice, I'm from the South, I'm from Texas, and this is my first living encounter outside of Texas. And we're coming up on a year, and I've survived, and people have survived me, so I think it's doing pretty good. Just a quick little personal note on me. I'm a mother of 5 and a grandmother of 9. I say 10 because one's almost here. So little bit of background on me, and I hope you guys enjoy this presentation. So just to get started, the purpose of this is making sure that your patient on their end is fully prepared for telehealth as much as possible prior to the telehealth encounter. This is something that I've dealt with in the past, but one of the things I noticed is, for me especially, having had experience in this area, when COVID hit, there was a lot of things that we took for granted and assumed that we had down, not taking into account that we were having a suddenly new, not so voluntary population of patients utilizing telehealth, which brought some new challenges. So I decided to do a presentation that really brings everything back to the kindergarten level, because I discovered I needed to go back to kindergarten in some of my protocols and how we did things when it came to getting the patients prepared. As you all know, if the patient's prepared, they're a lot more satisfied and can also retain and adequately communicate a little bit better. So I hope this gives you some benefit. I'm just really starting at the total basic level because I needed to go back there. So I'm hoping there's any of my lesson learned can be useful for any of you. So let me get to the next slide. Okay, So these are going to be the learning objectives today. So we're going to learn how to introduce telehealth, how to identify the importance of the technology assessment, understanding how to provide adequate resources, develop a process for financial verification, identify consent process, identify importance of patient education prior, and develop a process that decreases failed visits. So we're going to start first with introducing telehealth. This, just a little bit of background, this presentation is geared primarily to the ambulatory setting for telehealth of the patients outside of our facilities. I'll bring in a couple of things that would apply to the acute side as it comes into play. So when you're dealing with targeting a public community, what are your marketing abilities? First of all, your patients even need to understand that you have this service available. We found that there was a large population, even though in the middle of COVID and we thought we had this out there, we were not adequately utilizing the marketing that we could for a lot of patients that really were looking for this type of service. The next step is at the time of scheduling, especially when we're dealing with something along this line of public health issues, at the time of scheduling, offer them the option of telehealth, or at least advise them that it is available. Of course, that'd be appropriate to whatever the setting or complaint is. There's always going to be those that are not appropriate to do telehealth. That is another key to discussion, is any of those protocols that you can put into place up front to verify and identify this would not be appropriate. That'd be a time to hopefully have that able to identify. So if there's something, you would be surprised, a lot of times the scheduling is done by non-clinical, so they don't understand. So depending on how large your organization is, it may be fairly easy to do a list of absolute nots, complaints. It may be a little more difficult, but the best you can. One of the things we've discovered is it's our protocol here that any patient that has COVID symptoms, and that's their reason for those are not seen in our actual clinics of their normal physicians, because we're trying to keep our sick population contagious, a little scattered in different areas. So that would not be appropriate to put on telehealth. Number one, they've got to come in and have a test. Number two, they're going to be sent to a different facility for that. So any of those that you can put up front will help as well to make your process a little more smooth. The other thing that a lot of us were just not even thinking, we assumed if a patient said, I want a telehealth visit, they understood what that was. We discovered there's a large population of people that believe that's just as simple as a phone call. We know there is that possibility, but that's not always going to be appropriate. And the phone calls are temporary. So if you're setting up any kind of sustainable telehealth operation, you're going to want to make sure that you have the adequate needs for telehealth. Just asking the patient, do they have a phone or internet, may not be appropriate, because we had several that were scheduled telehealth and all they had was a flip phone. So that was not, they didn't have email or they didn't have good internet service. It didn't go on and assess, do they have a computer with video and microphone capabilities and or a smartphone tablet that would allow that? What is their signal connectivity? Do they have decent signal with whatever their device they're going to use, or history, or can you help assess that? And have they ever done any type of video chat prior, whether it's FaceTime or Zoom or whatever? Have they just had that type of interaction? Those are just 4 quick questions you can do at the time of scheduling the telehealth that will really help decrease some of those failed visits, because what we're really trying to avoid is the frustration on both ends of both the patient and the provider of, at the time you're trying to connect, discover one of these is an issue, because then you have to change your whole plan and interrupt the schedule for the provider and for the patient. And that just leads to satisfaction issues on both ends. These, our providers are extremely busy and they have their schedules set up. And for them to have to realize suddenly at that time, I can't do this, this isn't going to work. You're both frustrated on both ends. in that scenario. We just are trying to avoid as many of those scenarios prior as possible. So how to assess the platform. So when they are being set for the appointment, that's the time to discuss, will they be required to download anything, or will it just be a link sent to them at the time of the visit, and how will that operate? Doesn't take a lengthy education, but just make sure when they're scheduled, this is one of the points addressed, because again, if it's not, that leads to confusion and issues as we get to the time of appointment. Step-by-step instructions of how they're going to access it. You're going to receive a link, you're going to click here, you're going to do this, you're going to do that. Or will you just download an app, and how that is? One of the things that we did is we put our step-by-step process. All of our scheduling people have that in front of them and can discuss it with the patient. But we also have it in a PDF format, and it is totally accessible online. So that helps the patient so that they can see ahead of time, this is what it's going to look like. I will do step 1, step 2. Here's a screenshot of how it will look like on my phone and what I can expect. It's nice to have them be able to review that ahead of time. And even at the time, makes them feel a little more comfortable and prepared, because a lot of our patients now are experiencing telehealth for the very first time. So, there's always a fear of the unknown and confusion that comes with that. So one of the other things we discovered is that not all platforms utilized will prompt the patient to make sure their microphone and camera are allowed to access on that. So if there's any way to identify that ahead of time or assist them with that, that'd be something to discuss with them. And or if it is going to give them a prompt that says allow video, microphone, camera, make sure you tell them, please say yes. Patients sometimes are just scared of pop-ups. They don't know what it means. They'll just say no because they don't understand it. Offer some sort of test session, especially if they've never completed telehealth before. They don't have to, and it will be time consuming for some, but at least do the best you can to offer that for any of them, especially if they've never completed one before or they seem a little unsure of the process. That makes them feel a little more in control when it happens, and a lot more ease for both them and the provider. Another option that several of them will offer is someone in the office staff can get connected with the patient and then bring in the provider when it's time. And then that removes the frustration of the provider doing all of that troubleshooting, making sure that they're on good, and that can be settled ahead of time, history taken and whatnot. So again, any of those visuals that you can provide with the patient in whatever format, whether it's something you can email to them, send a link, or have posted somewhere, is very helpful as well. So privacy. We were quite surprised that we have patients that will be standing in the middle of the grocery store, in the middle of the checkout line, trying to conduct their telehealth visit. We as providers totally understand our background needs to be adequate. Our other people don't need to be involved. We all understand HIPAA and what that means. We do need to take the step to advise the patient at the time of scheduling that they need to be in a private place, because everything that is said is going to be available for anybody else around to hear or see. It's a good time to address, is there anybody specific they want present with them? A lot of times, certain population are dependent on someone else in the family or a close friend to go to all their appointments with them, help them interpret, help them manage their care. So that's something to assess and find out what your platform is capable of. A lot of them you can have multiple people from multiple sites. So verify, is there someone particular that they want in with them, and what process you would need to make sure that's all safe and secure, and allow them that just as you would that person to accompany them to the office. Reassure them that everything on your end is private. You've brought this privacy discussion up to them. So just reassure them, everything's private here. Nobody but your providers will be involved. And therefore that helps them understand what they need to do on their end. So another key is This is an area that's always difficult in any service that we provide in healthcare, and specifically to telehealth. The payer source and the rules and regulations are just very difficult to map and understand, and they change minute by minute. But we, as we get into this, always develop a little sense of certain payer sources, certain plans, and what they do or don't allow. The last thing you want is to have scheduled several of these appointments and then find out afterwards you're not going to get reimbursed and the patients are going to be billed. It's very possible that your patient population would believe, I get on and I'm seen, well, and I didn't have to pay anything right then. Well, that means I didn't have to pay if my insurance covers it. And that surprise bill, obviously, makes it a little unsatisfying for them. So as much as you can, keep a database as you can of what insurances what they do and don't do. And any pre-authorization, any of that you can do to inform the patient of their cost, or even just, your cost could be this. We're going to file it, but it could be. And educate them on the payment process, when and how it's going to be collected. As much of that can be done either at time of scheduling or prior to the appointment, because we also encourage that someone from your office reach out to that patient just prior and verify everything, make sure they're ready, just as you would when they walk in the door. They're greeted by a receptionist who is making sure everything's okay, checking their insurance, checking all of that before they get moved on to any clinical setting. So it's another very tricky and difficult area for us to deal with in telehealth. And so it's not always easy. Worst case would be, if you're unsure, just advise the patient up front, there could be a charge. Just don't want that surprise in the background. In addition, for both ends, you don't want to have a large population that you can't get reimbursed for and the patient can't afford to pay. So the next thing is consent. Every state has a different regulation and rule on this. It's not consistent from state to state. There's also a lot of leeway with the public health emergency of what we may or may not be required to do on this. So definitely any state that you are seeing the patient in, because keep in mind, these types of rules are going to be based on where that state's patient is located. So if you're providing any telehealth in another state, you would need to know what that is. The typical things that you would run into would be the patient has to somehow give some sort of written consent. It's not as popular as it used to be, but it's still out there. So verify if that's needed and how you would address that. Does it have to be in actual writing, or can it be as simple as a digital confirmation or something that goes through the application? Find out what that is. One common way to address this in the ambulatory setting is in those consent to treat forms that a patient has to keep on file. You have to keep on file for them for all these things in general, to include some verbiage in that they're also giving consent for the use of telehealth in between those in-person visits. So be creative. It's a creative scenario we're in, but just, research what's required in that state. One of the other common things that you will find that some are requiring is that the physician has to note something in their documentation that the patient was consenting. This is so that it's real easy. You can come up with smart phrases or catchphrases or copy and paste phrases, however your system's capable in your EHR, and create yourself a phrase. And there's two common topics that have to be addressed. One is you always have to notate that this was done audio and visual. You can't just say this was virtual, this was telehealth. You need to say that it was audio and visual, and then just include in that quick little 2-3 sentences, explain to the patient this would be fully audio and visual, patient consented to proceeding in this manner, whatever, however you want to phrase it. Look up your rules and regulations for where that patient's going to be treated according to CHS and the CMS and the state, and go from there and just create your little phrase. Easiest way, create that phrase that you utilize all the time. Okay, I think that's what we've covered mostly for consent. I do know that in some states, and be another thing to look, they will require that if the patient is not consenting or there's a technical failure, that you have a policy that states what is your backup process and what would happen from there. So if there is anybody in the acute scenario here as well, there will be cases and scenarios where in the acute setting, especially your ICUs and EDs and areas, patient may not be, they may be comatose, they may whatever for whatever you're doing. So you would figure out whatever documentation process you would need to do about their general line of implied consent and that type of stuff scenario. Just because that patient is physically unable, it will not necessarily prevent you. Just look up those regulations and rules, in particular for the facility you're providing that in. Again, I spoke to this earlier, offering a test session to verify that your platform and theirs. One thing we've discovered is some of our telehealth providers, as they are newly coming on to utilizing our telehealth platform that many physicians have had success with, their particular office will have connectivity issues, or their particular computer will have some issues. So that's another thing. Any provider that is beginning this, the device, the location that they plan to utilize on their end, that testing should happen prior as well. We've run into a lot of scenarios where last minute, a physician sudden scenario, they have all kinds of staff out, they're having to do telehealth, they don't have a choice, and they conduct that first visit and everybody's dissatisfied. And sometimes it turns out to be actually on the end that the physician is trying to utilize. So verify that on both ends, make sure there's stable connectivity. That will, of course, again, avoid those last minute cancellations and increase the comfort levels for everybody in utilizing this. Appointment time, at the time of appointment, and I touched on this a little bit. So there's many creative ways to do this. One of the things that I really do my hardest to advocate for in the clinic settings that are utilizing telehealth, that's a hybrid model where you're scheduling patients to come in and you're providing telehealth. Anytime you have a dual process like that, when I say dual process, I do my best to avoid a dual process. I would rather find how we can plug this into the normal process flow of what they would do with a physical patient, and only change those points that would have to be changed to make this work. It causes less confusion, less mistakes and errors and all of that. So in a general setting, your patient most likely is arriving 10 to 15 minutes prior to when they would actually be connecting with the provider. So they're walking into the office. That's when you're determining their copay, signing them in. So we recommend for those, you make that call to the patient 10 to 15 minutes prior, someone from the office staff, just as the receptionist would. Remind them of what they're going to do to actually connect, any other touch points you need to do, give them the details of what that backup process is. If it fails, will you call them? Will they call you? So if everything disconnects, they can't get connected again, you don't want them just hanging there thinking that we forgot about them. So those quick points, remind them of that process. At that time, may be the appropriate time to deal with any of the copay. You can choose to do that up front, or you could choose to maybe discuss that with them virtually, whichever. And then verify their environment's appropriate. If you see that they're standing in the middle of the county fair, you might say, can you move to a private location? Establish that connection. If there's a delay, keep them informed. Our providers, it's best we try. It's extremely rare in that scenario that a provider is, even when you show up in person, that provider is able to walk in that room on cue at 10:05 or 10:22 or whatever they've got on their schedule. So just things get backed up, things happen, you get complicated patients, you get things that happen, and they can't just leave one patient just to go to the other. So when you see that there is a delay happening and they're expecting that physician to get on the line with them at 10:15, and you see there's going to be a delay, keep them informed, just like you would people in the waiting room. Keep in mind, people in the waiting room can see that the office is busy. They're watching that there's a whole lot of people sitting in here and no patients are coming out. Things are running slow. People on the other end waiting, they don't have any idea what it is and will feel neglected. So as much as possible, establish, however, and just say, you know, we anticipate that the physician will be calling you at this time. But if you see that it's going to run 3, 4, 5 minutes or more over that, you might kind of touch base with them as much as possible. Keep them informed. There again, that ties into that satisfaction, and they feel important and they feel part of the plan for the day. So again, like I said, if someone on the staff wants to establish that connection, make sure they're not pointing the camera up their nose, they don't have it covered, their microphone is working, and then bring the provider in after all of that has been taken care of. All right, so in conclusion, this isn't a real lengthy presentation. It's just, like I said, I discovered we really had to go back to the basics, and I've been in telehealth for several years. So I want to put this out there for lessons learned that we learned the hard way, and hope that many of you can avoid these. So first, we need to identify the appropriateness for telehealth. Again, avoid putting as many of those on the schedule as you can ahead of time that would be inappropriate. If it's something that would need a test, that would need to be cultured, or that does physically need to be touched, looked at in person. Can't always get those lists exact, but do the best you can to avoid discovering that at the time the patient's expecting to be seen through telehealth. Assess their technology status, verify that yours has already been proven to work effectively, and provide them a detailed insight of what to expect. It's particularly for the ones that have not done telehealth before. Verify what consent process you need and that that's done. Offer them an ability to test and troubleshoot. They're not required to, but at least offer it. All of this will avoid those last minute changes, which cause confusion and stress for both ends. And there again, keep them informed as anything's not running according to schedule or changes or is slightly different. Keep them informed and in the loop. And that is the end of my presentation. And I am so excited to meet with each of you guys today and share what I have dealt with.
Thank you so much, Sandi. So now is the time for questions. Please submit those again through the Q&A function at the bottom of your Zoom window. I've got one right here. We've got somebody that popped on late, but they asked, what platform do you guys use at your hospital?
We're currently using the Amwell platform.
Okay, thank you.
And the second part of her question is, do you have any positives or negatives that you have seen from your platform?
From our platform, it's just undergone a little bit of an upgrade, and I will say one of the things I'm very excited about is it now offers the patient the ability to rate the visit when it's over with a thumbs up or a thumbs down. That's great insight because they don't always tell you what they think. And so especially when they're not coming in and looking at you in your eyeballs with those upset faces or smiles, you don't know. So that's a great thing. The other thing it does is it does allow the provider to rate the quality of the session and the technology. And so that's wonderful insight to be able to look at. So many platforms offer that. That's one thing that I would really look for, because it really gives you insight that people aren't verbally going to tell you. Our providers are so busy, they're not going to take the time to call me and say, this one was bad, this one wasn't good, I don't like this, until they've had 150, and then they're very upset. So that's one quality in any platform that a lot of them are offering that I would say is very pleasing to me. One of the other things that we have is it does prompt the patient as they're signing on to test their microphone and camera. They're not required to get in the session, but it does prompt it. Another thing feature that are in several platforms that I do like is the ability for the provider and the patient on their screen to see, not just say that there's a signal issue, but it will say which end the signal issue is on. That really rules out a lot of those, because we haven't always had that ability in our platforms, and the providers always said it was the patient's end, or the patients always said the provider. This helps you dial that in. It helps you dial that in and figure out. Sometimes I have found out there are some physicians that their offices, we thought we had everything addressed, and no matter what we had done, they were having horrible signal issues. So those would be some of the key features that I think are really amazing in keeping the satisfaction on both ends.
Mm-hmm. One of the things that we're seeing, Sandi, is there at the beginning of the pandemic, there was 4,000% increase in telehealth claims nationally. But some of the articles that I have read recently, and even this morning, we're talking about as a national average that about 20% of visits are now being done virtually. What is it like for your organization?
We were close to that range, but it's waxing and waning. I think a lot of places across were watching that national average and trying to set an internal goal accordingly. But as it jumped in, a lot of places were really pushing it hard during that first surge and doing everything they could to keep as many patients at home. You saw that across a lot of organizations, and so there was a higher percentage. It's tended to be dropping and nationally, but there again, we're starting with the surge to see a little more. I think the biggest key for any facility is finding what is sustainable long-term and preparing for when those regulations come back. So setting things up and understanding what the hardcore regulations were before, and being prepared to go back to that if you have to with something sustainable. We all know it probably won't be as restrictive, but we don't want to miss the one or two things that do come back that we don't want to come back. I think at this point in time, the percentage average is still a little difficult to shoot for because we're having this surge up and down. I don't think that'll kind of be a long-term settled goal to figure out until we're kind of past this pandemic.
Mm-hmm. Yeah. Absolutely. And speaking of platforms, I wanted to mention that across our region, so Illinois, Indiana, Michigan, and Ohio, some of the top platforms that we hear people using are, and I just lost the first one, Doxy.me and Doximity. We've also heard people using Zoom, Microsoft Teams, in some cases WebEx, but just as you said, make sure that you're using a HIPAA compliant platform and that you've done your due diligence internally on that platform.
I know probably the best thing for any organization is to, as an organization, say what is or is not acceptable platform for you, even if you do multiples, and just put that out to your providers and say, please don't use anything that you've already had all of your security and IT teams vet for security compliance. And if you want to give them multiple options, that's fine. But I think that's probably the biggest key, and just make sure they all understand, don't use anything but this without checking with us.
Mm-hmm. Absolutely. So as we're waiting for additional questions to come in, I'm going to go ahead and ask Carolyn to put a link in the chat box for our survey. As a federally funded program, we are always being asked for feedback from our funder, so that helps us to plan future events and make sure that we're doing our due diligence in providing your needs to you in our webinar series. So what additional questions do you guys have? Anything? Wow. You had a quiet audience today.
It's lunchtime.
It is lunchtime. That is true. That is true. So what do you think, from your perspective, Sandi, with Lutheran Health Network, what were some of the biggest barriers to overcome with patients?
Fear of the unknown.
Mm,
And that wasn't just patients, that was the providers.
mhm,
There was just a fear with the patients that it was, until trying it, their
mhm,
fear was it was detached, it was technical, the physician wasn't really going to be taking care of them. But there again, exposure really changed that. We
mhm.
have very few that after doing telehealth express that, but we have a lot that prior to trying it expressed that. And then once trying it came back and said, I was excited, I was amazed, this is wonderful. But it's fear of that unknown is the biggest hurdle.
Yeah. Was there any provider or um, staff support person that was a very big naysayer in the beginning that has really become a champion for your organization?
Yes, and it was the same scenario. I don't know if you've noticed the same trend. And this isn't in Lutheran, this is at the organizations I've worked throughout my career. When people see me coming with telehealth on providers, there are two provider sides. This is horrible. This is here to take all of our jobs away. This is not appropriate. You stay away. Or there's the ones that are like, we can't get enough. Tell us how many ways we can do this. Prior to the pandemic, there was a lot more of the ones that said, this is horrible. You stay away. You're the evil person of our facility. We don't want your stuff anywhere near us. But when the pandemic started, they were the first ones beating down my door going, I don't want to see these patients in person. You're going to have to do something, or my patients can't come in. That's been the biggest conversion that I've noticed, that now there's fewer of them digging in their heels because either they've experienced and discovered it's not so bad and they've found wonderful ways to complement their schedule, or they've discovered that their physician, even though they're not sure about it, their partner physician is loving it. So they're just kind of keeping an eye. So that being forced into, I say, the voluntold scenario really has changed a lot of that fear.
Absolutely. Yeah. We all fear the unknown. All right. Well, I'm not seeing any other questions. So I want to thank you again, Sandi, for spending some time with us and presenting this topic again. It's such a valuable topic because so many organizations are going through the exact same thing. And I think the ones that will persevere and continue to see patient volumes higher than pre-pandemic are going to be the ones that do take the time to work with their patients to make sure that their patients do test the platform beforehand and let them know. I mean, it's kind of like I remember waitressing in college, and the manager was like, so how long should people be seated at the table before you come over and get their drink? And I'm like, I don't know, a couple of minutes. And they're like, no, 30 seconds. People get, and it's the same. You're so right. Your example of people waiting in the waiting room and seeing patients come out and go, but in a virtual waiting room, they don't really know unless your platform has some type of a waiting room feature that says, the doctor will be with you in 5 minutes or whatever. They get really antsy. Yeah. So, all right. Well, thank you again, Sandi, and
Thank
thank you
you.
all for joining us today. Have a great rest of your day.
Thank you very much.
Bye.